Okay, thanks a lot, Dr. Sharma. This is my pleasure to be here on this day in my motherland. You know, when I had gone to USA like 42 years back, and on and off, I have been here, and also this opportunity, especially the Indian Institute of Science. I do remember when I was doing my PhD way back in 1980s. I had been here because one of my other affiliated the entity is NIMS, where I was doing some neurological research. So with that, I had the opportunity to visit IASC, so back, several decades back. So I'm so glad to be here in this podium by the Podacon. So I have to thank Podacon, and also I need to thank ALPS, the American Limb Preservation Society, Dr. Armstrong, and he's going to have a small, introduction for the next talk. For this talk, this is basically the industry session. There's another company by the name of Advanced Biotech, which is using the technology of ours, and they're making the product. The first product got introduced way back in 2000 time frame. They are having the manufacturing in Chennai, India. The basic talk I'm giving today is science behind wound healing, focusing on infected DFUs. Okay, with this, okay, when I was telling uh, Sanjay Sharma, Dr. Sanjay Sharma, that I'm going to talk about the matrix, where I'm more specialized in. He told me, no, Guna, I mean, this focus is on infection of diabetic foot ulcers. So can you focus your talk on this? Then I thought that when there is one product that is manufactured by Advanced Biotech, which is one of the antimicrobial agent incorporated. It's basically meant for subgingival infection treatments, and this product has been introduced way back in like 2001 time frame, which is successfully having so many clinical publications, which anybody can go and look into Google search on periodontal plus AV. You'll hit with lots of clinical data. So basically, the thought is the matrix. See, I'm going to address the matrix part in a more nano molecular level. See, so far you guys have been introduced and had also talked with lots of clinical data, clinical evidence about the way in which you do the treatment of diabetic foot ulcers. Also, you were talking, people were talking about the microbiology, what kind of microbes are invading. So all these things are very extremely important, and I'm coming from the different breed, So you guys are all clinicians, you have so much expertise, and also we have the respect for all the clinicians who are all performing the life-saving jobs. So first of all, I have to thank you for all the clinicians who are doing the mission of saving the industry of healthcare. So my expertise are in the matrix. So from the matrix point of view, I want to say that what we are having is a unique matrix. And I'm going to address all the matrix information in a bit. But as I was telling that this product, which has been used for subgingival infection treatments, can also be used for any type of wound healing applications where there is a need for antibacterial agent usage. So we have the tetracycline hydrochloride incorporated type 1 collagen, and it has a dual role, because people are thinking that killing the bacteria is the only job of the antimicrobials to take care of the issue, but that's wrong, in my opinion. because after the eradication of the bacteria, what we done is to make sure that the tissue is properly formed. And that's one of the very important things in the treatment of any kind of a wound, the infected wound. So having that in mind, you can imagine that by even, see, this we have experienced in the subgingival treatment arena, where if the patient treated for the periodontitis, using our product are quite happy even after 3-4 months, they don't come back. But there are other kind of products which are doing the same job of treating the subgingival infection. But the doctors are complaining, hey, the patient is coming back after 3-4 months. Why? Because the infection is taken care by the antimicrobial agents, but on the other hand, the tissue damage that was caused by the bacteria, unfortunately, is not having the recoupment or the regeneration of the tissue. This is a very essential thing. So, right? So, I mean, the dentist, the periodontist, he doesn't want to have the patient coming back to him again and again, and he loses his reputation. The patient, oh my God, this doctor is not a good doctor. No, I'm coming back again and again for the treatment of my gingivitis. So, having this in mind, based on the dual properties or the double acting thing of having a product or the antimicrobial incorporated into a matrix that is more biocompatible and also more bioactive than the rest of the matrices. That's what I'm going to have my focus in the coming slides. Okay, now I'm going to switch the gear to the matrix. Basically, where I'm having my expertise is the place I'll be, dwelling more. So, with respect to my, knowledge is basically having a matrix for all different surgical applications. And I had been in the industry of biomaterials for the past, half a century at least. So with that experience, I'm trying to say what is a biomaterial, right? Biomaterial is any biologically interactive matrix for the medical or surgical application. So having said that, we all can think of different matrix materials. The matrix materials are made of proteins, and under which collagen, fibrin, silk, all those proteins come under. And then we have the polysaccharides. I'm going to address polysaccharides in a brief way, because sometimes polysaccharides for the treatment of the diabetic foot ulcers looks a little bit contradictory. Why? Because polysaccharides are nothing but carbohydrates. Carbohydrates are nothing but glucose type of molecules, sugar molecules. So when we try to treat a patient for having the diabetic ulcer, why should we introduce the material or the matrix that is enriched with polysaccharides, which are going to increase the glycemic level of the blood? So just I thought that since this is a group of diabetic foot ulcer treating doctors, I thought I can throw that piece of information. And with respect to the hyaluron, the chitosan, as well as the autografts and allografts, xenografts, all these things are intact tissue-based materials. And among all, the other major classes of biomaterials are either non-biologicals or biological composites, and we just talked about. And with respect to the advanced tissue regenerative biomaterial, I would say is the native type 1 collagen. Okay, I have so many reasons to defend this from the biochemical point of view. And once again, I don't want you guys to think that, hey, come on, we are clinicians, so we don't care about the biochemistry, but at least, as Dr. Nambiar, who was the chief of, I think, the IASC, she was pointing out that the interdisciplinary, interaction is extremely important, right? So I come from one field, But of course, I have my knowledge in my field. But you are all clinicians, you have your knowledge in your field. I think if we all have the ability to work together and understand, it will be great, I think, in my opinion. So now I'm addressing the reason why I'm preferring the type 1 collagen compared to the other collagens. Okay, number one, the homology or the amino acid sequence across the species. I'm not talking about intra-species, even across the species. In interspecies, the homology. What homology means is the kind of similarity of the amino acid sequence is extremely identical or highly homologous, more than 97% in the type 1 collagen. What that tells you? It basically tells that if I happen to take type 1 collagen from one species or one animal and implant it another animal, it doesn't reject. So it's biocompatible. So the surface chemistry of all biological the interactive features are there. It doesn't matter whether it comes from a bovine source or bovine source or chicken source. So we have patented the extraction of type 1 collagen and purifying that to the degree that it has the high degree of biocompatibility. And the next one is the way in which the regenerative aspect. See, there again, now I need to tell you from the micromolecular aspect, the collagen has the ability to, I'm talking about the pure native type 1 collagen, has the ability to do lots of natural functions, as long as it has the native structure. And once again, now I talked about the chemistry of type 1 collagen, why it is important. At the same time, the same collagen, when it is structurally compatible for the tissue regeneration, that's what we need. So from that perspective, the type of type 1 collagen preparation that is being made by the company Advanced Biotech, which is one of the sponsors of this event, they made it more similar to skin. So that is one of the reasons that it has the better ability of having a better cellular infiltration. The pore size of the structure of collagen fibers having the same kind of like 20 micron porosity, which is equivalent to the fibers, the skin collagen structure, which is very essential for the good infiltration of collagen, for the infiltration of cells. Okay, this is one important thing. Otherwise, if you happen to, say, for example, making the collagen to a sponge of having on the average 200, 400 microns, see, that is not an ideal space for the cells to migrate easily and then dwell and then make that space comfortable for the cell development. So that's why even the structure of the collagen should be very significant. Okay. Now I'm moving on to the next aspect. And I'm kind of a little bit rushing for two reasons. One, already I see, hey, come on, move on. We are not that much interested in chemistry, biochemistry and all. So we are clinicians, so we have better things to do, So, but still, I need to give some kind of introduction about what I'm trying to talk about. So this is the second aspect of the advantages of the type 1 collagen. What we are having is the next level of the modification of the protein. It's called phosphorylation. Probably you might have heard of post-translational modifications of a protein. This is one of the essential things from the biological aspects of in our metabolic system, in our physiological system. it undergoes a series of changes. Now, as clinician, I'm trying to put down my presentation in a way so that from the clinical point of view, you'll understand. So we know all the different stages of wound healing, right? So once when the wound healing cascade of events start, the collagen that is produced by the cell goes to the extracellular matrix, and there it has to undergo different changes. For example, once a tissue is damaged, that damaged tissue may have different types of tissues. It has anywhere from the, for example, if it's a skin damage and the tissue damage, the skin tissue is damaged, some underlying bones are damaged, the muscles are damaged. So each one tissue of our system is having the ability to get repaired by that particular cell line. For example, the skin has got epithelial cells, and if you have the muscles, myoblasts, and for the bones you have the osteoblasts. So once when there is a repair to be made, all these cell lines have to be recruited. But in our biological system, all the cell lines are not lineated and circulating in the body all the time. So we are having these stem cells. The stem cells have to be recruited at the site of repair. How it is done, that's where the post-translational modification of a protein comes into place. So among different modifications, phosphorylation is one such modification which induces the cell signaling. And that's what the product that are produced for the repair of the tissue has gone through. So this is a very important thing which I wanted to bring it to your attention. And for example, if you happen to see in the Google search protein phosphorylation and cell signal transduction, you will at least hit with 3.5 million scientific technical publications. What that tells us, it has so much importance in our physiological system for the tissue repair and regeneration. As I told that the signaling is happening after that extracted collagen comes out of the cell, goes into the extracellular matrix where it is supposed to do its job, but there's no the cells available to do the repair. So the signal is sent, and the signal triggers the attraction of the cells to the surface of the phosphorylated collagen. So the stem cells are coming into place, and these stem cells get lineated to the appropriate cell line that are needed for that particular tissue repair. So this is the important thing. I don't want to go into the details of the chemistry right now. Okay. Here, I would like also to talk about a little bit of the glycosylation, and the reason I'm bringing this at this time because the whole conference is on the diabetic foot ulcer, right? So from the point of view how the diabetic foot ulcer is happening, normally we know that poor circulation is one of the reasons, and the peripheral neuropathy is the other one, and the immunological dysfunctions are the other one, and infection is the other cause of the non-healing nature of the wound, and also the oxidative stress. In addition to this, one thing which we are not recognizing is the glycosylation of the protein. I was telling that once when the collagen is secreted into these into the extracellular matrix, it has to it is undergoing different post-translational modifications. One such modification is the glycosylation. Okay, hyperglycemia is the reason. And once the collagen is is glycosylated, the maturation process that is one of the aspects of the wound healing process to complete is being impeded. Impeded. The maturation is happening through what they call the enzyme lysyl oxidase. Lysyl oxidase is the one which is not going to be active once when the collagen, which is supposed to be matured, is glycosylated. So this aspect is very important, and also this will come handy to see how the native type 1 collagen will be assisting to reduce the impact, negative impact of the glycosylating situation of the diabetic ulcer arena. This again to re-emphasize what are the difference between the normal individuals and the diabetic patients. We all know the triple helical structure of collagen, right? Collagen has the reason to be having 3,000 molecules of amino acids in one molecule of collagen because the surface chemistry has so many functions. Anywhere from having the collagen attaching to the platelets or platelet-derived growth factors or heparin and also different types of growth factors. So it has so much of the functional aspects, and at the same time, once when I told you, right, I mean, in the diabetic condition, if the molecule is having the glycosylation done, it is not going to let the collagen mature. So this is one of the important things I would like to address, so that you can get to know about what is the reason for the collagen to be having the ability to help the impact of the glycosylation in the hyperglycemic conditions of the diabetic patient. What it is doing, what the native collagen is doing, it acts as a reservoir or an adsorbent of the excess amounts of glucose. Thereby, it just reduces the negative impact of the prevention of maturation happening by the glucose, extra glucose. So this again is very important aspect, and these are all the aspects which are addressed in the product that is manufactured by Advanced Biotech, and that's one of the reasons if you happen to see the healing rate of the wound happens within at least gets initiated on day 4 and 5. There are clinical data out there. So, and since I'm going to continue the talk with the next presentation, I'm going to say thank you for this little presentation, and